Have you ever seen rat droppings in the corner of your house, heard scratching sounds in the ceiling at night, or quickly swept away a dirty, dusty storage room without thinking much about it? Most people see rats as annoying household pests, but what most people do not realize is that rodents carry dangerous viruses and bacteria capable of causing severe lung infections, organ damage, internal bleeding, and life-threatening illnesses. Sometimes people become exposed without even having to touch the rats, but exposure can be gotten from breathing contaminated dust, eating food exposed to rodent saliva or waste, or cleaning an infected space the wrong way. And that is exactly why understanding rodent-borne diseases is so important. So today we are coming for the rodents, exposing the dangerous diseases they can spread, how these infections happen, the warning signs many people ignore, and most importantly, how to protect yourself and your family, especially in this time. So welcome to Mira's Health Hub. I'm Mira, and if you're seeing me for the first time, don't make it your last by subscribing, because on this channel you will get quality health content that is straight to the point, medically accurate, and is worth your time. So if that sounds like your kind of content, please subscribe now and let's begin. Rats and rodents survive by living close to human beings basically. They invade kitchens, food stores, ceilings, farms, drainage systems, abandoned buildings, and even bedrooms in some environments. As they move around, they leave behind urine, saliva, droppings, foul particles, and contaminated materials. The dangerous part is that many germs carried by these rodents are microscopic. This means that people may become exposed without even realizing it. And because rats multiply quickly and move through dirty environments, they can spread infections across homes, markets, restaurants, storage spaces, and communities. Many people think they have to be bitten by a rat before getting infected, but humans can become exposed through breathing contaminated air, eating contaminated foods, touching infected surfaces, drinking contaminated water, or cleaning rodent-infested areas improperly. Imagine entering an old, dusty storeroom filled with rat droppings. The moment you start sweeping aggressively, contaminated particles may rise into the air and enter the lungs during breathing. And this is one reason why rodent-borne diseases are linked to poorly ventilated spaces, abandoned buildings, farms, warehouses, and storage rooms. One of the most frightening rodent-borne infections, with the most recent infection, is the hantavirus. Hantavirus is a group of viruses carried mainly by rodents. In humans, certain strains can cause a severe condition called Hantavirus Pulmonary Syndrome, also known as HPS. This illness mainly attacks the lungs, and people often become infected after inhaling particles contaminated with rat urine, saliva, or droppings. At first, symptoms may feel like regular flu or malaria. A person may develop fever, fatigue, body aches, headaches, chills, or nausea. And because these symptoms resemble flu or malaria, like I said, many people ignore them initially by just treating with anti-malaria or flu medication. But as the infection progresses, things can suddenly become dangerous as the lungs may begin to fill with fluid. Hantavirus causes severe shortness of breath, rapid breathing, persistent coughing, chest tightness, low oxygen levels, and respiratory failure. From research, some patients has described a sensation as feeling like they are drowning from the inside of their own lungs. Now, not all hantavirus strains behave exactly the same way. Most strains spread from infected rodents to humans through contaminated particles. However, scientists discovered that a specific strain known as the Andes virus, found mainly in the parts of South America such as Argentina and Chile, can spread from person to person through close contact with an infected individual. This became a major health concern during the recent investigations linked to a cruise ship outbreak involving the Andes strain, where health authorities monitored possible human transmission among passengers and crew members. Another dangerous rodent-borne disease is the Lassa fever. Lassa fever is a viral hemorrhagic illness commonly found in parts of West Africa. Lassa fever is caused by the Lassa virus that is commonly spread by a rodent called the multi-mammate rat. Humans may become infected after close contact with food, surfaces, and household materials contaminated with rat urine, and feces. Lassa fever can also spread from person to person, especially through contact with contaminated body fluids. Early symptoms of Lassa fever include fever, weakness, sore throat, headache, vomiting, body pains, chest pains, or diarrhea. But severe cases may progress to facial swelling, difficulty breathing, bleeding, shock, organ failure, and hearing loss. In fact, some survivors of Lassa fever develop permanent hearing impairment even after recovery. And despite being called a hemorrhagic fever, not every patient experiences dramatic bleeding symptoms, as some people become critically ill without obvious bleeding at all. Now, beyond hantavirus and Lassa fever, rodents are linked to several dangerous infections. One of these examples is the leptospirosis. This bacterial infection spreads through water or soil contaminated from infected animals, including rats. People may become exposed through cuts in the skin or contact with contaminated floodwater, and symptoms include fever, muscle pain, vomiting, red eyes, and in severe cases, kidney or liver damage. Rodents can also contribute to the spread of Salmonella bacteria through food contamination, which leads to diarrhea, stomach cramps, fever, and dehydration. Historically, rats were also associated with the spread of plague through infected fleas. Although plague is far less common today, it remains one of the most infamous rodent-linked diseases in human history. One dangerous thing about many rodent-borne illnesses is that they often begin like common infections, and people end up dismissing the symptoms, tagging it to be fever, stress, malaria, or just flu. But warning signs that should never ever be ignored includes persistent fever, difficulty breathing, severe weakness, chest pain, unusual bleeding, confusion, persistent vomiting, dehydration, or worsening symptoms after rodent exposure. This is very critical because early medical attention can save your life. Now, the good news is that prevention is very possible, and honestly, prevention is one of the most powerful weapons we have against rodent-borne diseases. To reduce your risk of infection, first you have to store your foods properly, cover water containers, dispose waste correctly, seal holes where rodents can enter your house, avoid leaving food scraps lying around, and keep kitchens and storage areas as clean as possible. Rodent infestation should never ever be ignored, and if you notice droppings around your house, unusual smells, nests, or scratching sounds, address the problem as early as possible. Never sweep dry rat droppings directly, because doing that can push infectious particles into the air and you would inhale them. Instead, wear gloves, use a face mask, open windows and doors for ventilation. You can sprinkle water in the area first and then spray disinfectant. Allow the areas to soak, then you clean carefully. This simple step would significantly reduce your risk of exposure. Please seek medical attention immediately if you develop high fever, difficulty breathing, severe weakness, bleeding symptoms, persistent vomiting, confusion, or worsening illness after possible rodent exposure. Do not assume every fever is malaria, and do not rely on self-medication if symptoms are becoming severe. Go to the hospital. Many people underestimate rodents because they are common and they are all over the place, but common does not mean harmless. Sometimes the smallest exposure, such as the dust in a neglected room, the uncovered food in a contaminated environment, or the droppings ignored in the corner of the house, can carry very serious health risks. And that is why this awareness is very important. Understanding how rodent-borne diseases spread, recognizing symptoms early, and practicing proper ventilation could protect not only your health but the health of your family and community. So if you learned something from this video, share it with someone, because this is the information people genuinely need to know about to protect themselves and their loved ones. And that's it, people. Subscribe to Mira's Health Hub for more medically accurate, deep, educational, and life-changing content explained in a simple and relatable way. And until next time, take care of yourselves, stay informed, and love yourself always. Bye.